I'm a neurosurgeon and treated about 1,000 patients with surgery for Parkinson's disease and over the last 25 years or so. And what I'd like to tell you is how can we make the surgery better? How can we make it safer? How can we make it more comfortable for the patients, and how can we make it an easier process for them so that more and more patients could benefit? How can we get the most out of surgery? What are the advances that we have? So despite all the advances in Parkinson's disease and despite all the drugs that we use, there are still patients with Parkinson's disease that are disabled. And surgery can play an important role, and this has come about because there have been significant advances in the surgical field. So for example, as we've heard, we now are able to take great pictures of the brain so we can see the targets in the brain, so we have better brain imaging. We now have better neurosurgery. It used to be 100 years ago when you went into the neurosurgeon, you never knew if you would come out alive or not. But now things have changed. Now your chances are a little bit better than they used to be. The equipment is much better. We have smaller electrodes, smaller implants, and so the equipment has made a tremendous advances. And we understand a little bit better as to where to go in the brain. It's no longer hit and miss, but now we go after specific targets in the brain, such that about 150,000 patients with Parkinson's disease throughout the world have now received deep brain stimulation. And this is being done at a rate of about 10,000 operations per year across the world in about 700 centers. So every major city in the world now offers DBS to patients with Parkinson's disease.